Good morning, everyone. And we're going to start this meeting. I just want to let you know that the live stream is not working at this present time. They're working on it. So we are going to proceed and go forward. Can I have a call of the roll? Thank you very much. Is there any declarations of pecuniary interest? Hearing none. I can move forward to the adoption of the minutes from February 8th. Chair Henry, seconded by Councillor Dyes. Any questions? All in favor? Thank you. We have no statutory public meetings, and I'm going to ask for a motion to amend the agenda to allow for delegations to go prior to the presentations. Mayor Carter, seconded by Chair Henry. All in favor? Thank you. And I'm going to call upon with delegations. Mr. Kehoe, you are here in person, and you have 5 minutes, please, and thank you. Good morning.
My name is AJ, and I'm a Durham Region resident. Since January of 2013, I've been an observer at every meeting of DNHC, Durham Nuclear Health Committee. Today, I'll ask you to please restore in-person public participation at DNHC meetings by upgrading them to a hybrid format. I'll start with some background information. There are many technical problems at OPG's Pickering and Darlington plants that can cause a disaster much worse than Chernobyl. If this happens, I'd probably lose my home, my job, and much more. I can't afford these losses, nor can the vast majority of people who live here, but no insurance company offers coverage for losses caused by nuclear disasters. The good news is that OPG's technical problems are fixable, and OPG has staff and money that could fix these problems. The bad news is that OPG management doesn't want to spend this money, and experts have described their excuses as absurd. CNSC, Canadian Nuclear Safety Commission, has the authority to force OPG to fix these problems. But CNSC doesn't have anywhere near enough staff to regulate Canada's nuclear industry. CNSC would need many thousands of highly qualified staff, but they currently employ less than 1,000 people. Canada's Office of the Auditor General reported problems with about 75% of CNSC inspections, and I blame this on staff shortages. Even if CNSC had enough staff, a serious concern is that they're allowed to make mistakes without consequences. If CNSC approves a license for a plant that fails catastrophically, they won't be jailed, fined, or fired, even if they knew the license should have been denied. In 1995, Durham Regional Council created DNHC to study nuclear issues in Durham. DNHC was intended to analyze and report problems, but instead they actively promote the nuclear industry. Several members have financial interests in the nuclear industry, so there's a lot of bias here. Getting back to good news, DNHC's in-person meetings were unique in Durham because they invited observers to ask questions during the meetings. After each presentation, DNHC members would sometimes ask questions, and then the floor was opened to relevant questions from observers. Each observer brought a tremendous wealth of knowledge to DNHC meetings, and we asked many questions that DNHC members had never considered. DNHC members come from a variety of backgrounds, but no human is all-knowing, and DNHC members often had follow-up questions for presenters because of questions asked by observers. Many presenters made a point of saying that they greatly appreciated the questions from observers because our feedback helped them with their work. Before September of 2022, DNHC was forbidden from including any questions and answers in their meeting minutes. This is quite unfortunate because there have been so many amazing questions from observers over the years, plus some great questions from DNHC members too, but none of these from before 2022 are publicly available in written form. Their webcast didn't begin until June of 2019, so there are no public records of the valuable discussions from before then. For 25 years, DNHC had in-person meetings with public participation, but these were changed to virtual due to COVID-19. The public is forbidden from using Durham's virtual meetings participation system, so observers are currently unable to participate meaningfully in DNHC meetings. We've been given an email address for sending questions to DNHC, but our questions aren't asked during meetings, nor are they shared with all participants or in the meeting minutes, and most of our questions never receive a reply. The replies that I've seen haven't always answered the questions, and follow-up questions have been ignored. With a hybrid format, presenters could continue presenting remotely, and in-person public participation could be restored. Everybody wins. The only disadvantage of this proposal is that hybrid meetings would probably return to the length of in-person meetings. Their virtual meetings have averaged about 2 hours, whereas their in-person meetings averaged about 3 hours. Most of this extra hour was due to discussions prompted by observers, but there were also 15-minute breaks, and each meeting began with introductions. There have been no breaks during virtual meetings and no introductions either. Introductions make it much easier to identify everybody, and by having each participant say their name and title into the microphones, audio problems can be detected and solved before the meetings commence. Durham Region Health and Social Services Committee, will you please restore in-person public participation by upgrading DNHC to a hybrid meeting format? If not, please explain why. Thank you for your time. If you have any questions for me, please feel free to ask.
Thank you very much, Mr. Kehoe. Any questions? Seeing none, thank you, and thank you for your submission.
You're welcome.
I'm now going to turn to presentations. There's no questions, Mr. Kehoe.
Okay.
Thank you. First in our presentations is from Dr. Kyle, Commissioner of and Medical Officer of Health, and Dr. Kyle.
Chair, before I begin, Director Pincombe is going to give some opening remarks covering both health and social services. So if I may, I'll turn it over to her and then.
Absolutely.
Good morning, Chair Roy, Chair Henry, and members of Health and Social Services Committee. I apologize for those of you that have heard this probably 3 or 4 times at least so far this week, but I just appreciate the opportunity to provide introductory comments from the finance perspective on the health and social services budgets that you have before you today for deliberation. I just want to start by thanking the senior leadership teams of Health and Social Services for all their hard work and dedication in the development of the budgets that are before you today, and especially to Jonathan Dixon, Curtis Taylor, Zara Jaffer, and Troy Cheeseborough for their leadership on these files, as well as the support and leadership of the commissioners for these 2 areas. The budgets before you this morning achieve the regional council's approved 2024 budget guideline of 7.5%. They are aligned and support the region's strategic plan, and the paramedic services budget before you is aligned with the 10-year strategy that was endorsed by council in February of 2023. The budgets also support critical investment in core services to meet our growing needs of our community. You can see this through many of the social services programs in health and in paramedic. It advances critical growth-related and asset management capital infrastructure, in particular in paramedic, long-term care, housing, and our directly operated early learning and child care centers. In the health budget, we continue to have focus on recovery efforts and catch up on core public health services. As well, throughout both budgets, there's significant inflationary pressures and capital cost escalations that are reflected and provided for within these budgets. In terms of process, following your deliberations today on these 2 budgets, they will be advanced to Finance and Administration Committee for their deliberation on March the 19th, and then on to Regional Council on March the 27th. Thank you very much.
So if we could have the deck, great. So before I begin, Chair and committee members, I just want to echo Director Pincombe's remarks. I want to recognize Director Jaffer and Chief Cheeseborough, who have been our budget leads with respect to public health and paramedic services, respectively. And we have worked very closely with Finance Commissioner Taylor, Director Pincombe, and their team over many, many months to get us to this point today. So thank you very much for your guidance and support. Just trying to So before you is a list of our 2023 accomplishments. I'm not going to go through them other than to say that 2023 on the public health side continued to be response to COVID-19 and other respiratory viruses and restoration of programs. And for both public health and paramedic services, we continued to respond to community needs. So the business plan and budget before you is demonstrated in these two pie charts. With respect to the proposed spending plan, as you can see, it's just north of $145 million operating and capital. And in terms of the impact on property taxes, in the pie chart on the right, you can see that the impact is just under 47%. So what are the strategic investments in public health? They're listed here. And what I would say is, in essence, we're preserving capacity that was created during COVID-19 to support largely ongoing work in our infectious diseases. And I don't think there was anything I wanted to magnify. It's fairly straightforward. And on the paramedic services, the strategic investments are listed here. And as you heard from Director Pincombe, we continue to build capacity in paramedic services with respect to both staffing and facilities in accordance with the implementation of the 10-year Paramedic Services Master Plan. In order to meet the departmental guideline assigned to us, there have been a couple of deferrals that are listed at the top. With respect to risks and uncertainties, they're listed at the bottom. The only thing I wanted to magnify is, as you heard at the last committee meeting, there is a strengthening public health strategy underway, and we expect during the life of this budget that the review and revision of the Ontario Public Health Standards, protocols, and guidelines, which really define our work, is likely to be completed, and there may be changes to our mandate beginning as early as 2025. In terms of forecasted pressures and strategic considerations, apart from annualizations, changing regulatory landscape in the case of paramedic services, inflationary pressures, et cetera, I think for the most part they're captured here. So that's a very high-level overview of the business plan and budget before you from the Health Department. Happy to answer any questions or defer to my colleagues, Chair, if they're better suited to answer questions.
Thank you very much, Dr. Kyle, and thank you to your team as well, too. The questions are to the presentation, so I'm going to move to Mayor Foster first. We are back online as well, too. Mayor Foster.
So thank you, Madam Chair. A question for you. Would you like me to move the report so we can deal with both the presentation and the report at the same time?
You're brilliant.
Okay, so I'll move. I'll move that.
Can I have a seconder for the Councillor Jupp? Thank you. All in favor? Okay. Please go ahead. So to the report and to the presentation.
Thank you. May the record show that Mayor Roy described me as brilliant. That may be the only time that the record.
I haven't drank my coffee yet this morning.
So generally speaking, and to Director Pincombe, I have, and the system is the system that we have. We build into the boxes conformity with overall direction. 7.5% is the direction this year. How do we, and I guess for both commissioners, how do we accommodate within that 7.5% budget increase a recognition of changes in the strategy? So, for example, homelessness. or unsheltered. I think there are a couple of different ways of describing, and I'm not quite sure which the politically correct term is. But as we have a top-down mandate, can we speak to if that reflects that mandate reflects the resourcing that we need out of a budget, recognizing that equity and equality are not the same thing. Hi, Nancy. Good morning.
So if I may, I'll answer from a high-level perspective, and then, given we're in the health section, if Dr. Kyle has any comments. Our CAO mentioned this yesterday because the same question was asked, a bit slightly different wording. Council set down a directive of a 7.5, and the directive for the non-police for the balance of us is 5. And so all the sequence of budgets that you see before you compile together to meet that 5. Every department had to make various trade-offs in order to get there. And as we've talked about in prior years, it's not a uniform allotment of that 5 because there's great variations in the funding methodologies within all the programs. So that's a quite particular example when you talk about health and social services. They didn't just get a proportionate share based on their budgets. They, in some cases, would have been squeezed more because of the share of their budget that's tax levy financed versus the gross budget. So we've delivered when we accumulate all these together based on the council direction, and trade-offs had to be made to get there. Don't know if that's the answer to your question.
Yeah, so it's the answer to the question, and I probably didn't ask the right question. Nancy, moving forward, because staff have to respond and have to do what council determines. Moving forward, and it is a different undertaking. Should council be considering different ways of approaching the budget? Such that our strategic goals are better reflected in the allocation of resources. So we've never done it before, and staff are fantastic. This is focused on us as the decision makers, and you sometimes as being boxed in by the decisions that we make.
So I will start an answer, and then the CAO may want to comment. So the budgets that you see before you are based on the priorities that council has laid out for us, and the 2025 strategic plan work that's underway will then become the guiding document for future budgets. What we're unable to control is the priorities of council that need to be funded by provincial or federal government. That's what's creating our problem with respect to responding to the priorities of council to the degree that council would like to see and our residents would like to see in those high priority areas. So we do feel strongly that the budget is accommodating the priorities set by council, but the dollar limitations are there with respect to the amount of services in those priorities that can be provided. And we had a very long discussion yesterday pertaining to federal and provincial funding from the transit perspective. So our challenge is how much we can deliver on those priorities with the property tax being the limitation. And again, I'm not sure if our CAO would like to.
So I'm just going to jump in, and I don't want to cut the CAO off. I'm looking at a slightly, so again, please do not interpret my comments as staff not implementing the strat plan and the decisions of council. We are all well aware that Durham Region, and later on, I'll ask some questions. I suspect I'm running out of time here. About the budget process and shortfalls, but we have to take care of some issues that the feds in the province are just not stepping up for. My concern in setting that limit for each department is it may not reflect the reality, and that's on us as a council, not on you. Madam Chair, how am I doing with time? Because I do have, do you want me to hold off and let anyone else speak, and then I can keep going?
We'll come back to you later, Mayor Foster.
Okay, perfect. Thank you.
We'll
Thank
openly
you.
share that we did not put the timer on for you. Because he's brilliant. CEO, would you like to make a comment?
I think Nancy covered it well. We are very focused on priorities. Thank you.
Okay, thank you. I'm going to turn now to Mayor Carter.
First of all, good morning, Madam Chair. Thank you very much for the opportunity to be able to ask some questions. Dr. Kyle, thank you. First and foremost, my comments are to your team. Thank you for their dedication, innovation, and hard work on behalf of the residents of Durham Region. I really appreciate it. I do have some questions through you to Chief Cheeseborough, if you don't mind. I know that Chief Cheeseborough is with us. Based upon the budget that is in front of us today, and based upon the first 60 or 70 days into 2024, and the information that we have in regards to the request for EMS assistance when it comes to our overdoses, because I know that in our community and other communities, those numbers have grown tremendously in the first 70 days. Do we have the right resources in regards to the investments that are necessary to meet the challenges moving forward in this budget? Thank you.
Chief?
So thank you for the question, Councillor Carter, and through the chair. I believe, yes, the endorsed plan for the master plan from Council does support responding to these initiatives. I think some of the misconceptions that are happening out there with respects to our overdose numbers are they're globally reported in some cases and not specifically addressing our opioid challenges. So when I run reports specific to our opioid challenges, they're significantly different than the numbers we're receiving from our lower tier partners in fire services, for example. And this is due to the, I'm going to say, the poor dispatch system, for lack of a better term, that our government provides us, that generally categorizes many, many different situations as overdose. And then when the crews arrive, they're determining that it's not actually an overdose of the opioid nature, but it could be an incidental or accidental, diazepam or lorazepam or a benzodiazepine or something that somebody inadvertently took. So to answer your question, I believe, yes, these numbers do support it. We're only seeing overall in our call volume, we're actually seeing a slight reduction in the first 2 months of this year versus the 2 months of the previous year. Yet with the additional resources put forward by this council and supported, we're seeing an increase of about 6.8% in our staffing hours. So we do believe we can support the increased volume that's currently being seen by us.
I appreciate the response. Again, just to follow up to the chief. Chief, is there anything that within your professional designation and your peers that are doing to be able to address the complexities of what your paramedics are seeing on the front lines that we should take under consideration as we're developing our strategy moving forward, and what kind of investments would be vital in regards to our paramedic services?
Yes, thank you for the question, and through the chair. So the continued investment in the community paramedicine program, specifically our PCOP program within this community, is very valuable. We're seeing some very, very positive results with that program with respects to addressing the challenges of not only the homelessness, but the opioid addiction issues, and our partnerships with social services to create that and present that to our client base is a very positive step. So I think if anything, continued funding and support for our PCOP program would be of great value. And we're continuing to lobby the province, of course, through our provincial association as well, to continue to fund some of these, because we do see them as essentially a primary healthcare initiative, not necessarily the responsibility of a lower tier, but we all recognize that the upper tiers and lower tiers are bearing the brunt of this in a lot of cases. So as a provincial association, we also lobby for support of these types of programs going forward. And I can tell you that, as a matter of fact, today we have some provincial representatives out reviewing our program yet again, because they'd like to expand the program we currently deliver within this municipality to many other areas within the province. So again, thank you to this council and those that supported our PCOP program in the past and continue to support it.
Thank you, Chief. Again, I'm going to follow up with you. Much of the discussion many times goes to our offload and code zeros that sometimes we face because of the delays in our emergency wards. Is there anything that you see in regards to what would help in regards to that moving forward in 2024, 2025? And do you have an estimate of if you could reduce the time even by, let's say, 120 minutes or 60 minutes, what that would be able to do in regards to your operational efficiencies?
Yeah, thank you for the question. And through the chair, it would be huge. So forecasting for 2024-25, we're forecasting about 26,000 hours of offload delay throughout our different hospitals within the municipality. I just recently submitted our funding to the province, our request for our Dawn funding, which again they support. The challenge we're all experiencing, and the hospitals included, are the staffing challenges with respect to getting the resources in to be able to assist with the offload delay. So I think just continued lobbying and support to ensure that the province supports additional resources such as nursing and those sorts of things to allow them to ensure the hospital has the resources necessary to support us. And we're going to continue to work with the hospital because we have some strategies we believe we've developed that may assist us, where the hospital may consider buying some resources that we would be able to utilize on the paramedic services to get our staff back out on the road quicker. So we do believe we are challenged by offload delay. We still are. But if we were to mitigate that, to your point, by even 60 minutes and have that as our threshold. The current government guideline is 30, but we're well above that. If we had a 60-minute threshold, we would probably see about a 62% increase in availability of units on the road.
Wow. Chief, I really appreciate the data. That helps put it into perspective in regards to some of the challenges there. So again, to your team, your frontline people, and those that are associated with your organization, please pass on our thanks for their dedication on a daily basis dealing with, in my opinion, Dr. Kyle, one of the most complex times in healthcare that not only our province is seeing, but also our nation. So, Chief, thank you very much for all that your people and your team do on a daily basis. We are so grateful for that. So I appreciate it. Dr. Kyle, my last question, because I'm running out of questions to you. I noticed that everybody is always saying the one thing that scares them, of course, is the uncertainty of provincial funding and funding that goes into your department. I also presume that you're always on the alert in regards to any type of new pandemic. Do you believe that we're well positioned and we've got money in the budget to be able to prepare us in regards to if and when another pandemic ends up on our threshold here in Durham Region?
Well, the short answer is if you're talking something along the lines of the COVID-19 pandemic, that the needs were far broader than our department. It was really a regional response and a health system response, and you never have in your base sufficient resources to adapt to something of that magnitude. But for the infectious diseases that we commonly see, which often lead to outbreaks, for example, that we have to assist in managing, we've built capacity throughout the pandemic. As I said, we want to preserve some remaining capacity that was created during the pandemic. So I think we're well positioned, and I think we're structured in such a way that if we need to draw from other programs to reallocate to infectious diseases, if we need to reallocate from other divisions not involved in infectious diseases, I think over the past 3 or 4 years, we've kind of hardwired ourselves to be able to respond to surges. So I think we're better positioned than we were pre-pandemic. But if you're asking me, could we wisely spend additional resources meeting regional and departmental priorities? I think we can. But we know there are competing priorities, and we live within our means.
I appreciate the frankness, so thank you very much, Dr. Kyle. Madam Chair, thank you for the opportunity to ask those questions.
Thank you. I'm going to move to Chair Henry.
Good morning, Chair, and I just have a couple questions. The first one is to Dr. Kyle. So on page 13 of the report, conducted 1,543 rabies investigations with 163 residents. having to get treated. I'm curious if years ago the Ministry of Natural Resources used to do and treat at-large aerial dropping for rabies. Do we know if within the region is this mostly urban or rural?
So thanks for the question. It's mainly related to domestic animal bites of humans because of the population being centered mainly in urban areas. It's mainly urban areas, and for which the animal can't be properly confined for the appropriate period of time to see if any rabies behavior occurs. So it's largely urban. It's largely domestic as opposed to wild animals. And if you're unable to confine the suspect animal, you err on the side of caution and proceed with rabies vaccination. You don't want to be the medical officer of health who, under his or her watch, has had to experience a human case of rabies. The stakes are that high. So that's why you see those numbers. But it's largely domestic animals, and it's largely in the urban setting, but it doesn't exclude rural areas as well.
No, I just found that the 1,543 was a bit of a shock when I read it. So I'm glad that the 163 residents were treated, but there also, with rabies, there are needs, and I'm sure we're doing it, but there is an education program that the public needs to understand.
There is, and we do promote Rabies Month on a regular basis. You do what you can to promote rabies vaccination, and in fact, rabies vaccination in animals is a requirement.
And no warning signs from the Ministry of Natural Resources that there's a particular animal within Ontario that is...
So what we've seen is the distribution of bait has largely tackled rabies of fox origin. So the biggest risk in Ontario anyway are bats and skunks. Primarily bats more than skunks, and one of the problems with bats, this is would be one of those cases where you would err on the side of vaccinating and it wouldn't be a domestic animal, is you wake up and there's a bat in your room. Well, has it bitten you? Do you know? And so again, you err on the side of caution, but it's largely skunks and bats that are the main sources of rabies. But again, there's the risk of domestic animal bites.
Okay, thank you. And the second question I'll direct to you, but I think it'll probably go to our Chief of Paramedic Services. Great job to our team that responded to over 100,000 calls for service last year. But I know, and this is really to support Mayor Carter's comments, is it possible for us to get the data for the last 5 years on the number of calls and separated, because not every homeless person has a mental health issue or an addiction, but could we get the calls for 5 years by years, so then we're meeting with the other levels of government to talk about the number of calls related to opiates, the number of calls related to mental health, and the number of calls related to homelessness, and have them separated out so that we can see the growth, because pre-COVID, the challenges were much less than they are now. And when we're advocating with the other levels of government, the data that we can get from that can say, here are the signs. And then we have comparators. I wouldn't ask to do a big search, but for the regional government comparators in the province of Ontario to put together a package. So then we're advocating, whether it be any member of council or our champion, Mayor Carter, when we're meeting with ministers, both here in the province and in Ottawa, that we're armed with data that supports the arguments that we're making.
So perhaps I can start and then defer to Chief Cheeseborough. So you did request data with respect to the PCOP and related experience. So there is data that could be used for advocacy purposes in the PCOP advocacy report that was approved by council. I can't recall whether or not included in that report is the data that you're requesting from ambulance call information system, so I'll defer that to Chief Cheeseborough. But we did attempt to pull some data together to address that very need, and that would be contained in our PCOP report that was approved by council at its last meeting.
Yes, and through the chair, so yes, we can get that data for you. I can break it down on the 911 side and on the PCOP side and differentiate between the two. And we could even break it down as far as even within lower tiers. So it'll take a little bit of time to gather it, but generally speaking, we can pull that data in, I would say, probably a couple of weeks. We can have all that data for you.
So, Madam Chair, it's significant, but would you accept that as direction?
Yeah, accept that as direction. We did that with the PCOP data as well.
Okay, appreciate that. And again, Dr. Kyle, for all that you do, and to Chief, for you and your teams, and the rest of our Health and Social Services team, thank you for the great work you do.
Thank you. And I'm going to, before I go to Mayor Foster, I'm going to go to Councillor Brenner. Oops.
Thank you, Madam Chair. Dr. Kyle, also, I want
There we go. Oh, no. Hit it. There you go. Now you're on.
thank you. And thank you, Dr. Kyle, for your team and the amazing work that you do right across the region for public health. It's greatly appreciated. I want to pick up on a little bit more of the questions that Regional Chair had asked you as it relates to rabies. And the numbers, I guess, that of investigations and involving also the numbers of residents receiving orders. You mentioned that your work in terms of education and awareness, obviously responsible pet ownership. Can you also, I guess, elaborate a little bit more on the engagement piece and the coordination piece that you also carry out with all of the host municipalities across Durham region that have animal services as part of their portfolios?
So I'm skating on thin ice because I wasn't really prepared for this question. So my instinct would be to speak to staff and report back. I can tell you that we do work closely with animal services. We do work closely with certain veterinarian offices with respect to promoting low-cost rabies vaccination. But beyond that, I really am skating on thin ice. So if you don't mind, I will look into the matter further and report back.
Maybe we actually, rather than report back, we can probably talk offline if that's okay.
Absolutely.
The other question, you've identified in Part I, you've identified a very high number of catch basins treated for mosquito larvae in terms of West Nile viruses. Do you have the stats as to how many cases of West Nile viruses may have been actually reported and confirmed?
Not off the top of my head.
We'll talk offline.
Okay, thank you.
The third question, and maybe it's going to be the same response, and I guess we're going to do a lot of offline. I noticed that there's no reference to Lyme disease ticks, and I know that's a growing concern.
So yes, it is a growing concern. If you need data, I would have to dig deeper and report back, but it is, as the climate gets warmer, some of these vector-borne and tick-borne diseases are certainly taking hold and have become endemic in Ontario. And so Lyme disease is certainly increasing in incidence and prevalence in Ontario.
maybe for future reference, if we can include in these type of reports that type of information, I think it would be, especially because we're going into the warmer weather. Do you also, have you had to do, or are you able to do any kind of an enforcement as it relates to property owners, whether it's TRCA, conservation authorities, in terms of putting appropriate signage up to help? And I know you've got a great marketing campaign in terms of making people aware, but is there a mechanism that requires the owners of the property where ticks, in fact, are finding their ways, which is widespread, and I'm talking about places like conservation authorities, to post warning signs as a reminder to people that are using, even our own trail systems?
So if you're asking me, do we have the power of law to compel certain premises to take any actions to abate West Nile virus or the risk of West Nile virus, the answer is yes. If that includes signage, I'd have to check with my staff.
Maybe we can
and
talk
report
offline
back.
then.
Yes.
Thank you.
I should say that pre-pandemic, we used to prepare an annual vector-borne diseases report. And if memory serves me correctly, we did bring that forward to at least committee. So in my mind, I think I'll, in addition to answer your questions, inquire as to the status of kind of an annual report that we could then present to committee. I know that did happen pre-pandemic, but fell by the wayside during the pandemic.
Understood. Thank you, and we'll talk offline. Thank you, Madam Chair.
Thank you. Councillor Jubb.
Thank you, Madam Chair, and through you to Dr. Kyle. Thank you, Dr. Kyle, for the presentation. Briefly, a quick question on the 1% cap for 2024 to 26. Can you elaborate on that a little bit more? What
Yeah.
the one? Yeah.
Yes. So at the last committee meeting, there was a presentation from the Office of the Chief Medical Officer of Health regarding its strengthening public health strategy. So there are three components to that strategy: review, revision of the Ontario Public Health Standards, promoting voluntary mergers, and over a 3-year period, a 1% cap on the growth in provincial subsidy over the next 3 years. So that's what that's speaking to.
Okay. So to me, that doesn't keep up with the rate of inflation.
That's correct.
Okay. So it would be a download. Is that fair to say?
So how funding of public health works in Ontario, under the Health Protection and Promotion Act, public health is funded by what are known as obligated municipalities. So how that works in Durham Region, Regional Council is the Board of Health. It approves a budget. It sends a notice to the obligated municipality itself, and it's required to fund public health municipally. The province has discretionary powers to provide provincial subsidy, and the only requirement to get that subsidy is for 75 cents on the dollar, the municipality has to chip in the remaining quarter. But there's nothing in law that requires the budget, if you will, for public health to be funded through a iron-tight funding formula, 25, 75. It really pertains to the province's share. And over the next 3 years, a 1% increase certainly would not cover inflation. It wouldn't cover economic increases. It wouldn't cover annualizations. And is this a download? Well, this has been in place since the common sense revolution. So it's been around for 20 years or so. Maybe at the time it could have been considered a download, but it's now baked into the legislative framework for public health in Ontario.
Okay. Thanks for that. One question to the chief. Chief, there's going to be 16 new hires for paramedics this year. Can you put that in perspective compared to last year? Because I think last year it related to 2 12-hour shifts, if I'm right. Is that right?
Yes, through the chair. So this year, we're going to have 3 12-hour shifts, sort of to equate that out. We believe we're going to add a 24-hour resource as well as a 12-hour resource, which accounts for the 2 additional new units in the budget as well.
Okay, perfect. That's great news. Again, thanks to all your team, Dr. Kyle and the Chief, for all the great work that you do.
Thank you.
Thank you, Madam Chair.
Thank you. Mayor Foster, do you want to hit your speak button again? And Mayor Foster.
Thank you, Madam Chair. As a heads up, you will see me probably in about an hour disappear. I will be on my phone in a car, and I am not driving. For those of you who will see me on video with it, Doctor, at a really high level, if you looked at 2023 staffing requests and expectations that you had, as well as programs. Can you speak to what, if any, because you couldn't hire staff, things got in the way, what was deferred or left on the table?
Thanks for the question. So that was covered off in the slide deck. So when we constructed our staffing request, there were sort of 3 buckets. One was tailored towards preserving capacity. And these staff are captured in the current budget, and they are our highest priority because we have no bandwidth below it. We don't have any additional types of positions that we can rely on as we exit pandemic response. So they're captured in the budget. The slide deck refers to policy support in my office. So this would be about building capacity. So we have deferred that for consideration next year. And as well, in the deck, we refer to, I think, 3 public health inspectors, and we consider this, if you will, restoring capacity. So basically, the 3 positions would go to our general programs pool. They're the ones who inspect restaurants, respond to complaints, and so forth. And we are restoring capacity because those 3 positions have been permanently reallocated to infectious diseases. Why they are our lowest priorities, of course, we have quite a large public health inspectorate, so we do have some capacity, and the impacts really relate to response times and that sort of thing, unlike the other positions where just the work is not going to get done.
Doctor, thank you for that. And again, the direction of that question, are there things that we would like to do that for a variety of reasons we simply can't afford to do? And that, again, is direction from council to you. So, I want to thank your staff for doing the best that they can do with what we give you to do. On a high level, and this would apply to the broader budget and health and social services. You've got a 1% cap. Is it possible for us to capture over the last 3, 4, 5 years, whatever that number may be, the responsibilities that should rightly be paid by the province or federal government that we see ourselves required to step up to? So I'm looking at money that should be coming off of whether it's a harmonized sales tax, income taxes that are on property taxes. And I suspect if we looked at a graph, and I'm big about visuals, and while Ms. Taylor, Nancy is not, she's rolling her eyes because I do this every time. But do we have a, you can grin when you look at her because I know she is, and rightly so. Is there a way of articulating that publicly? People are upset about property taxes, as they should be, but a lot of stuff we don't have a choice.
So I can start and then defer to Commissioner Taylor. Over the last 4 years, we have been eligible for 100% provincial funding for COVID-19 response and for vaccine rollout. And the province has stepped up and provided us with the funding that we requested over that time period. So I'm not sure that looking back over the past 3 years would be terribly helpful, because I think it's fair to say that pandemic response vaccine rollout, the province has funded virtually all of that. But having said that, I will turn it over to Commissioner Taylor to either correct me or add to what I've had to say, or both.
So perhaps just a bit of rounding that out, if I may, Mayor Foster, your question may be more appropriately directed when we get to social services. Dr. Kyle explained the long-term funding mechanism for public health as always having been a responsibility, and he explained it quite clearly. So there's nothing that's changed there per se, whereas the new things that we're facing on the social services side with housing and homelessness, while they're not affecting health, particularly on the paramedic side, I think the argument over what's incrementally being added to the tax levy is probably more hit on the social services side, because health has always been embedded. There may be shortfalls in funding, give or take, on this 1% cap issue, but it's always been understood that how the public health system works, and certainly Dr. Kyle can correct me, but based on his explanation to Councillor Jubb, that's my impression, that it's kind of always been embedded on the public health side. So the argument that we should fund it is not necessarily a new and pressing one.
So I thank you for that, and for pointing out whether it's the province or the feds, where they have stepped up. We need to. We can't always complain, but I would suggest things like the offload, the increased strain on paramedics by virtue of the fact that we've got ambulances sitting for ages, and that could be difficult and too granular perhaps to get into. And Nancy, you're 100% correct. I won't bring it up now because it's not the right time. But when we look at some of the statistics from Health and Social Services, they're quite astounding. I will shut up now, but with once again, Dr. Kyle, to you and your staff, thank you. The list of things that we do and that we have to do is long and typically exceptionally well done. Madam Chair, thank you.
Thank you, Mayor Foster. And the last point, just about what the other levels of government should be paying for. I think this is a continuous conversation that's being had between all the committees, but I think more, especially with Health and Social Services, we're seeing a lot of lapse in the amount that we should be receiving. I know that Commissioner Stella will also be given highlight as we have had other reports and reviewed this as well too. Is there any further questions from members of council on this report? Seeing none, hearing none, we have a motion in front of us. All in favor? And that is carried. Thank you very much, Dr. Kyle, and to your team. And next, presentation with social services and the business plan and budget.
Okay. Good morning, Health and Social Services Committee. I am pleased to have the opportunity to provide you with information on the 2024 Social Services Department budget. But before I begin, I also want to extend thank you to this committee for your guidance and support to the priorities of our department. And additionally, I also want to thank Commissioner Taylor, Director Pincombe, and the finance team for their commitment to the social services business and budget planning. Their support and expertise have been instrumental to the social services team. And I also want to thank my social services executive team who are here with us today. Their commitment to the priorities of our department during a time of growing need is unfathomable right now. Additionally, there's support and guidance to the frontline staff who are working to deliver high-quality services to critical areas of our community are appreciated. A special acknowledgement to Director Jonathan Dixon, Manager Curtis Taylor, and Manager Tracy Tyner Kavanaugh for their work on creating this budget report and presentation before you today. I am pleased to include in my presentation that social services meets the budget guidelines set out by Council for 2024 while meeting the increased needs across our programs and services. The Social Services Department has a significant role in the delivery of human services to Durham residents. Job loss, financial hardship, family breakdown, or an aging parent bring people into challenging situations where they require support and assistance. Other program areas within social services help communities during emergencies, such as fire or natural disaster, or the support provided to our community housing providers and tenants helps the community thrive. The Social Services Business Plan and Budget Report provided to you details the department's 2023 accomplishments, and for today's presentation, I will be highlighting just a few of these programs. Beginning with Children's Services and the development of the 5-year Early Learning and Child Care Plan, 2023 to 2027, this extensive plan will ensure high-quality child care delivery across Durham Region. The 4 priorities of this plan are to support expansion and access to child care, enhance supportive and inclusive child care, increase, attract, and retain quality registered early childhood educators, and optimize virtual service delivery and technology. Also within Children's Services are the dedicated efforts to implement the Canada-wide Early Learning and Child Care System, also known as CWELC. This significant undertaking will improve affordability of childcare, and to date, 623 new childcare spaces have been established. Within our Family Services Division, the core service is to provide counseling services to individuals and families across Durham experiencing mental health challenges, job loss, or marital breakdown. Just over 9,000 counseling sessions were conducted throughout 2023. Social services includes provisions for supporting and caring for seniors living in the community and within the region's long-term care homes. The Long-Term Care Division delivers 24/7 high-quality care to 847 seniors and vulnerable residents with complex conditions across 4 long-term care homes: Fairview Lodge, Lakeview Manor, Hillsdale Estates, and Hillsdale Terraces. In 2023, our long-term care operations increased hours of care to residents from 3.8 hours per hour per day per resident to 4.1 hours per day per resident. This is above the provincial target of 3 hours and 42 minutes of direct care to be provided per resident per day mandated for no later than March 31, 2024. In addition to these efforts, long-term care met accreditation standards with Accreditation Canada with a 99% compliance and awarded the Accreditation with Commendation Award, a testament to the dedicated efforts of our long-term care staff. For our seniors living in the community who are experiencing financial, emotional, or physical abuse, the Social Services Department partners with Durham Regional Police Services through the Senior Safety Office. This team, comprised of a social worker and police officer, responded to 765 crisis calls through 2023. Investments to affordable housing continues to be our priority, and in 2023, our housing services team completed the At-Home Incentive Program application that can bring $8 million in investments to needed housing in Durham. The recommendations will be presented to Council in the spring of 2024. Housing opportunities were provided to 380 households on the Durham Access to Housing Waitlist, DASH, that's in 2023, and efforts continued throughout 2023 to support individuals experiencing homelessness to transition into housing programs, with 248 individuals obtaining a place to call home. Outreach services is an important component to the Social Services Department's programs and services. By increasing access to support services to those living unsheltered, the 24/7 outreach teams can help meet the challenging and complex needs of those living most vulnerable. The primary care outreach
Team, a partnership with Health, is a well-established mobile outreach service to people living unsheltered. And throughout 2023, there were over 3,600 client interactions. In addition, providing mental health and addictions counseling and support, the Mental Health Outreach Program had over 1,400 client interactions to those experiencing homelessness or at risk of becoming homeless. Through partnerships involving the Emergency Social Services Team, the Income, Employment, and Homelessness Supports Division, the Diversity, Equity, and Inclusion Division from the CAO's office, and community providers, there was a humanitarian response to over 700 individuals seeking asylum in the region, inclusive of Ukrainians and those primarily from African nations. Detailed on this slide is the 2024 proposed expenditures for the delivery of social services departments, programs, and services, key investments to the well-being of our residents and Durham communities. The proposed social services expenditures totals $584.9 million, and this represents a total net budget increase of $20.38 million, or 14.7%. The graph to the right of proposed funding details provincial and federal investments for the Social Services Department at a total of over $400 million, or over 68%. On this same graph, the property tax amount of $158.7 million continues to see growth due to provincial, federal programs and responsibilities with sometimes limited and or reduced funding investments. Essentially, municipalities are continuing to bear increased costs for delivering social services programs at a faster rate than any upper level of government funding investment can be provided. The 2024 strategic investments for social services includes $3.5 million increased regional investment in homelessness. That's a net property tax investment of $3.2 million. $0.6 million investment in the development of a poverty reduction plan and the implementation of the Community Social Investment Program, directly supporting local nonprofits. $0.6 million increase in rent supplements to support people experiencing or at risk of homelessness, a portion of which is funded from the provincial subsidy. That's $0.3 million. $8 million increased provincial subsidy for the full implementation of the Integrated Employment Services Program. And $0.7 million increased investment in staffing to expand available childcare spaces at the region's early learning and childcare centers, including the new Village Union Regional Early Learning and Childcare Center in Oshawa. Additionally, we are seeing $2.1 million in increased provincial investments for the delivery of the Canada-Ontario Community Housing Initiative, COCHI, and the Ontario Priority Housing Initiative, OFI. $0.4 million increased investment for the continued implementation of an emotional model of care for our long-term care residents. $2.3 million increased investment in capital maintenance and state of good repairs within the region's long-term care homes and the early learning and childcare centers. $6.8 million increase in provincial subsidy to the homelessness prevention program, inclusive of emergency shelter operations and the maintenance of 1635 Dundas. And $6.9 million as initial debt servicing costs for the Seaton long-term care home. Risks and uncertainties in social services. With provincial changes, we're seeing an uncertainty with provincial investment. In some areas like Ontario Works, funding levels have been frozen at 2018 amounts. Also, funding has been reduced within the Ontario Works portfolio due to the new employment system manager role. In our mandate programs, Ontario Works, early learning and childcare, long-term care, housing and homelessness, the region contributes over and above, in some cases, the cost share requirement or the administrative requirement out of necessity. We share responsibility for the programming, yet has no mechanism to fund the operations other than through property tax levies. The reduction or flatlining of provincial investments has significant impact to the region's resources and ability to meet increasing human services needs. This is evident in the childcare system, where there's been a reduction in administrative funding for implementing a comprehensive CWELC system. Provincial funding uncertainty with decreasing financial support that is required to sustain COVID-19 responses may result in cost mitigation measures and or the utilization of the Operating Impact Reserve funds. The Fixing Long-Term Care Act 2021 involves changing regulations and inspection protocols that can have direct impact to operations and to staff. And Bill 23, More Homes Built Faster Act, as mentioned by our Commissioner of Finance on several occasions, Bill 23 eliminates the opportunity to use funds collected from development charges for housing services. With the elimination of these charges, this may impact current and future housing projects throughout the region. Of note, this is at a time when heightened need is presented for housing options, including transitional and supportive housing. And Durham's nonprofit sector have identified pressures related to increased need, decreased funding and donations, and reduced volunteerism following the pandemic, all impacting their capacity to address community need. Looking beyond the 2024 social services business plans and budgets, I bring to your attention the following items of forecasted pressures and strategic considerations. Provincial and federal advocacy must continue due to stagnant funding levels for municipal cost pressures within current programming and lack of committed funding for responses outside of current mandates in meeting the diverse needs of our community. For example, immigration, deepened poverty, affordable housing, and access to housing options for people. The annualization of 39 positions proposed in the 2024 budget is estimated at $1.6 million, and of these 39 positions identified, there are 31 impacted by future annualized costs, and 8 are budgeted for a full year in 2024. There are continued pressures to address and reduce the wait list across several program areas, such as individual and family counseling services, long-term care, community housing, and childcare. Housing renewal and affordable housing development is to ensure diverse housing options for residents of Durham will be prioritized with the Riston School property, 590-650 Roslyn Road, the Durham Regional Local Housing Corporation revitalization, and Phase 2 of 1635 Dundas Street. And Children's Services staff continue efforts for their addition of 2 new directly operated regional child care centers through local partnerships. North Glen Public School in Clarington is scheduled to open in 2025, and Sunderland in the north is currently delayed. I'd like to thank you very much for this opportunity, and we are available to answer your questions.
Thank you very much. And I just want to also announce that at 9:30 this morning, it was announced that the provincial budget is coming out, and the statement is that, join me as I outline how we're rebuilding Ontario's economy without raising taxes and fees or putting more burden on businesses and municipalities. It's the statement that was put with the announcement. So, burden. Chair Henry, you want to say something? Okay. Mayor Foster.
Thank you, Madam Chair. I know I'm going to shock you with a suggestion and a motion, if you will take it, to bring 2024 SS2 onto the floor.
Thank you, Mayor Foster. Second. And Councillor Anderson, all in favor? Thank you. Please go ahead, Mayor Foster.
Thank you ever so much. So Stella, again, Commissioner Stella, you please take back to your staff. I'm amazed at the depth. Every time I read it, I shouldn't be amazed. I'm amazed at the depth of services that we provide. One of the numbers that struck me, assisted over 8,500 households with homeless supports. That's a scary number. So we are seeing an unsheltered crisis now. Is that way deeper than what we think, based on the numbers, and if they apply here, they do across the GTHA? That's a scary figure. Can you speak to that?
Through the chair, yes, thank you for that question, Mayor Foster. Certainly, this is when we speak about those in our community who are living somewhere. They do have homes, but they're struggling. They're struggling with food security, income security, and they're coming to visit various hubs, and this is where these numbers are taken from, or interacting with homelessness prevention teams to ask for supports for either to help them pay for their rent, for their utility costs, or other supports that they need. And it is a larger number. We've seen an increase, certainly from last year. I do suspect these are just folks who know about the service. I would suspect that there would be others out there, and that number could grow.
So if we don't, and we can't do it, we need support. from the feds in the province. I mean, do you see that number really surprised me? Do you see a looming? I'm going to use the word catastrophe, and I'm picking that word purposely.
Through the chair, well, certainly we understand that there are people being evicted due to rent evictions, and I don't even have those numbers right now. I mean, I'm sure that'll be in front of the landlord and tenant board in a year or so. They're behind, so we'll probably see more from that group. We know people who are visiting our the food banks. I think is it 60% are new, and of those, probably that many are actually working. They're working families who are actually visiting food banks because they can't afford to buy groceries for their families. The cost of living is increasing. People, I think mortgages will be coming up in the next year or two. I could see that number increase just for the sheer fact that those people may not be able to afford to pay the renewed mortgage payments.
And thank you for that. I'll another number, 100 trafficking victims. I would not, and those are the ones that you were just helping. That's a bit scary to the tip of the iceberg, probably, as it were. So thank you for that. On the debt charges, there's a rather significant increase, but I think you covered that. You went from $7,047,000 to $13,940 in the budget. So that 6 is the CETN, essentially.
Through the chair, yes, exactly.
Okay, and I'm going to chew on a familiar bone. You know it's coming. Is there an ability? I think we need to get out to the public and let the public know why property taxes are being driven. We can't ignore these problems. I heard the quote about burden, but a burden on businesses that need to lock their doors to get ID before you can walk in. Burden on businesses to put in CCTV. There are a variety of burdens that are maybe not appreciated. Is it possible to get a longer term view? Some trends in terms of how much money we are spending on services that we couldn't. You address 700 refugees that we can't ignore. They're here. We've got to do something. But there are significant amounts of money that this is call it a stealth downloading, if you will, to my mind. Can you speak to that? And is there a way of us better communicating what's going on?
Through the chair, so I understand your question, Mayor Foster, is you're saying how much above and beyond that is mandated that we're paying? Is that what you're asking? Sorry.
Well, I maybe I would think that increasing piece of the pie, and so in this budget, for example, or unexpected things last year, people paid up property taxes, things that they shouldn't have, and there were maybe different ways of articulating, demonstrating that. Maybe the question is, do you have a sense of how we might demonstrate, to the residents of Durham, how much of their tax bill is being driven by things that someone else should be paying for?
So, if I may, through the chair, there is a significant amount of work going on relating to that through the big city mayors, through FCM, through AMO, and certainly through the regional and single-tier CAOs and regional and single-tier treasurers. A lot of the work is being focused through AMO in order to create a consistent voice for advocacy for that, because it really has become a much more dramatic thing since COVID. So what you will see in our budgets, for example, and this was quoted last year, we'll refresh it for when we have our final approved budget numbers here, but from 2019 to 2023, we have increased our support for social services, public health bundles of things by $54 million. So that's a 32% increase in just that shorter time frame. So it just kind of gives you a sense of the order of magnitude, but certainly we are participating in a significant amount of work to try to better articulate. There have been some suggestions that some are going to identify it separately on their tax bill. It's almost an impossible task. Some have stepped back from that because we are trying to convince our federal and provincial partners to help us. So there's always that challenge with how much you call them out and still get assistance. But we will refresh that number, certainly the 32% increase from 2019 to 2023 for property tax support. And I know your clock is ticking as I'm answering long. I'm not sure if the CAO wants to add anything.
So actually it isn't. We changed that, and thank you for that.
I have nothing to add. I think Nancy covered it well. Thank you.
So may I suggest that we consider post-budget, as much as AMO can brush in broad strokes, and it's great work, bringing it home to a resident here. When they see their property tax, they understand. And there are two pieces to the story. One, that we are not doing enough, and I'm looking at the very visible, unsheltered, mental and addiction issues. What the heck are you doing? And we're doing a lot to be able to show what we are doing, as well as to be able to show residents that our partners are not doing their fair share. So I may encourage that we identify some key metrics and perhaps include that in communications. And once again, for all of the amazing work, thank you. Madam Chair, thank you.
Thank you, Mayor Foster. Councillor Anderson.
Thank you, Madam Chair. Is Mayor Foster saying we should probably have a line in the property tax bill that indicate that?
I think that's, and this has been the conversation we even had yesterday as to, in one, it's Guelph that the mayor there called it the pill, and what they've outlined what the federal and provincial should be paying for, and what your property tax would be if we were being properly funded. So I don't know, through the CAO to the commissioner at this time, if that ability is even the timing of it, but potentially afterwards, as Mayor Foster identified. I think it is, it's like he said, bring it home for the residents, and outlining it, I think it'd be a great educational tool.
So I'm just going to say, through the chair, the issuance of the property tax bills and how the local municipalities would have to do that is, there's not enough turnaround time, but certainly I think we're all interested in bringing forward information reports to this committee and through the CAO's advocacy team to elaborate better on that, to better communicate that message out.
Yeah, thank you. I think that would be the best method to communicate that to residents. And Commissioner Stella, can you convey the same message to your staff that Mayor Foster alluded to for me, and thank them for a well-written report? Having said that, and the homelessness, have you broken that up, the number? I believe you said there were 450 during our conversation earlier.
Through the chair, for our January report actually shows 586 on the by name list.
Okay. What percent? Do you know what percentage of that are refugees?
No, I don't know that. Actually, the refugee number is a separate number.
Okay. So, but there would be some, a significant amount, would you say?
The refugees, asylum seekers that are being supported today are at about 400.
Okay. Because that would be, maybe raw numbers would be a better method of communicating that to the federal government and the provincial government as well, mostly federal government.
Through the chair, yes, we've submitted our expenses for 2023 for the refugee asylum seekers, and we'll be doing so for 2024 as well, but we haven't received any funding at the moment.
Follow-up question. I know, like, the Ukrainian community, they're active in helping their citizens when they come here. Does other groups do the same to that extent, or no?
Through the chair, yes, they do. They do. You're correct about the Ukrainian community. They were being supported by the large Ukrainian community here in Durham, and most, I think all at this point, have moved on and are housed. And our partnership with CDCD is supporting the rest of the groups who are currently in the hotels. And many have been housed. I don't have the number. It's well over 150 since July of last year who've been housed.
Thank you. So you are reaching out to other community groups, because I know there are community groups out there. Because we can't do it alone as.
Cannot. Through the chair, yes. We have, and CDCD is very connected as the settlement area of Durham.
So again, through the chair, thank you for your hard work and your commitment to this.
Thank you.
It's appreciated. Thank you.
Thank you. Councillor Brenner.
Thank you, Madam Chair. Through you to the Commissioner. Stella, thank you as well. Want to echo the amazing work that you and your entire team continue to do. In some way, I think your team really does walk on water in terms of making things happen. In the report, you identified in the presentation some of the financial consequences as a result of withdraw funding from other levels of government, and in particular the province. One of the things that I don't see is how the generosity of the city of Pickering through the MOU with our casino revenue, which was for last year payable, I think came in the first 60 days of 2024, $4.2 million. I know it's a drop in the bucket compared to what we've lost as revenue, but I'm wondering if you can share with committee, or if there is a line item that identifies how much of that $4.2 million has helped in terms of delivering the mandates that your department has to deliver and does deliver.
Thank you. I believe Commissioner Taylor will answer that question, Councillor.
So through the chair, just for this committee's awareness, as you know, the entirety of the budget with all of the documents that go with each different reporting category come to Finance and Admin with all the linkages. And that dollar value from Pickering is included in the corporate line item. It's dedicated to social services work, but it's included in a corporate line item. And we are very thankful that additional funds have come in. And we're looking at, we've increased that to the full $6 million cap in the 2024 budget in anticipation that the popularity and volume of activity at that location is really helping. So we have increased it to the full $6 million in optimism for 2024.
If I might, Madam Chair, back to the Commissioner of Finance. So of that amount of the 4.2, how much went to this department? Because I know some went to other departments, I'm assuming.
So through the chair, we had fully put it to housing. So it's all here, and that's the intent with the $6 million.
Thank you. I appreciate that. And I think that is important because, again, I say it may be a drop in the bucket, but as we've heard, it does go a long way to filling the needs of helping the housing portfolio to address those that are unfortunately homeless, those that lack the ability for affordability. So I appreciate it, and thank you. And thank you, Commissioner, for providing that information.
Thank you, Councillor Brenner. Chair Henry.
Thank you, Chair. Just a clarification. So when you mentioned that we have currently 400 asylum seekers in Durham Region, we've had 1,000 since June of last year.
We've had 700 for sure that we actually can count in our
Okay,
yes.
700. So thank you for the clarification. Prior to June of last year, Durham Region had never seen an asylum seeker.
Through the chair, not really, not that I could identify. I shouldn't say that. Back in 2019, 2020, there was a program through Toronto, paid for by Toronto, and they did flow through to Durham for a period of time, supported by the Ontario Works staff, but not funded by the region of Durham, funded by Toronto, and then they were supported and housed.
Thank you. There was a huge announcement made, and where the City of Toronto received a very large sum to deal with the challenges they were having around asylum seekers. Did we ever qualify for any of that money?
We have submitted our application and our expenses for 2023 asylum seekers. We haven't received any funding yet, although we've been told that we should know sometime this week.
How long ago did we submit our funding application?
That was in the fall. I'm sorry, I'm looking to yes. Would you like to? Thank
Yeah.
you, Jonathan.
And to you and your team, you know, the work that you do every day is simply amazing and should be thanked. But it is work that weighs on our staff. And the great work that we've done on the file of human trafficking, Durham staff are experts. We've been recognized around the world for the work we do, but with expertise and when you're doing a great job, you tend to create more work because you're now better at identifying those challenges. So there are problems with human trafficking, and you know, I believe it's crimes against humanity. But for the work that you do on that file, thank you as well. Councillor Brenner talked about decreases from the federal or provincial governments. I'll pick on both governments today. And Madam Chair, I feel bad when I pick on the other levels of government because when the MPs and MPs hear you, they often weigh our complaints against, you know, the options for funding. And there should never be a decrease for funding for any municipality across this country for being vocal on really big issues. So I'm going to follow up on the comment you made after I follow up on this one. So we had a decrease of $4.5 million in the provincial subsidy for the employment of Ontario Works. $4.5 million is a lot of money. Where did we find that $4.5 million, or did we just lose it?
We did some transferring of resources from that program, from Ontario Works to homelessness, where the need was, and to the employment system program. Again, there was a gap there. And the rest of it we will determine throughout the year. We don't want to reduce any services to clients, so we are working through that, and we will let you know as the year progresses.
So thank you. So for members of council, that's half of 1% on our budget, our tax increase this year. Half of 1%. It's greater than half of 1%, but it is shocking. And, you know, Madam Chair, your comments earlier on the provincial budget and that it won't increase taxes. My argument is the lack of dealing with the challenges around mental health addictions and homelessness are increasing the taxes on residents within municipalities across this country. And not the country, well, the country, but in particular Ontario. And it's disappointing that $4.5 million doesn't seem like a lot of money in our budget, but when you narrow it down to half of 1%, the challenges related to asylum seekers, you know, without funding, will there be a time when Durham will just have to say no?
Through the chair, as the head of this department, it's not something I would want to ever say no to people who need support in our community. However, this is something that council would have to help us make that decision.
So members of council, Durham is the fastest growing region in the province of Ontario, you know that, but we're also a leader in jobs. And, you know, I had a chance to meet with a number of our asylum seekers with staff a little while ago, and all the asylum seekers I met were all professionals. So when you're meeting with doctors and nurses and engineers and professional people coming from other countries, don't we have shortage of doctors and nurses and in some cases engineers? So you don't have to answer this question but wouldn't it be nice if they could fast track the standards of education in this province, as they've talked about for years and years and years nationally, so that, you know, a doctor that's coming to us from someplace in Africa can treat the very people that are coming here because Canada's that lighthouse of, you know, hope and destination where people want to come. The system is so badly flawed, yet the answers are so simple. So thank you. Another rant yesterday, today. There'll be one tomorrow.
I appreciate it. It's all good. And I think one of the things that when we just did our review yesterday with the budget and that, we've had many reports in the past few months talking about the shortfalls from Ontario Works to rent support and all that. And if we were to take all of that, like, it would be quite substantial. And to know that we're still at like 2018 for Ontario Works for
Yeah.
and we compensate for the remainder of that. Like, again, there's no listening, and it's frustrating. But thank you, Chair Henry. I'm going to turn to Mayor Carter next.
So, Madam Chair, I'll pick up on what our regional chair said. There's a wonderful letter that I'll share with not only this group, but also with members of council that came from Mayor Marcus in Aurora, and reminding us when you criticize the federal government, you will be punished. As we were noticed yesterday, that the city of Oshawa will also be punished for its criticism of no response in regards to the Prime Minister responding to our letters that we've sent here, that it's been made quite clear that we will get $0 when it comes to the Housing Accelerating Fund. So, I add that to our cautionary tale about how we can actually have conversations and ask people to be accountable, but understand that we will pay an ultimate price. So I'll leave that for everybody's knowledge, and I'll share this letter with them because, it's, unless you have a sitting member, you don't get anything. So anyways, that being said is, the OW rates, how many clients do we have on the OW client list now?
We're well into the 9,000.
9,000? And has that
benefit
grown?
units, sorry, benefit units, that's
Benefit,
families, yeah.
And have those numbers grown over the last year?
Yes, actually they have.
Do you know what that number would be?
I'm looking to my team, and I can, about 20% increase over 2022-3.
20%? Talking
Is that
1,800
accurate?
new clients?
Oh, easily, yeah. Who's going to take that? Lisa? Thank you.
It's on. So applications have definitely increased. We've seen a rise in applications like we haven't seen in a number of years. So all of those are being processed, but we have seen our caseloads go up, as well as the asylum seekers and refugees are arriving, they're increasing caseloads as well as soon as they're eligible to come onto a caseload.
Okay, and are we around, did I hear it right, about a 20% increase from the previous year, which would mean 1,800 new recipients across the region of Durham on the OW list?
Yeah. So it looks like it's about a 1,300
1,300, okay.
So yes.
And just to pick up on the regional chair's questions, is OW 100% funded by the province, so it's just flow-through dollars?
The program, yes.
That's the benefit aspect, but the staffing aspect is our responsibility?
50-50.
50-50 on the staff?
On the staff.
And that the benefits, the direct benefits are Ontario, come directly from the province?
Correct.
Okay, so I just have a better understanding there. So,
But can I correct something? But the cost share 50-50, we also over-contribute.
I'm sorry?
We over-contribute.
We over-contribute? What does that mean, over-contribute?
We pay more than our 50% allotment.
But
to
isn't
be
the
able to-
agreement for 50-50?
It doesn't work like that exactly.
What do you mean?
Now I'm going to open up a different category, and perhaps I need to turn it to Jonathan Dixon to explain a little bit.
Yes, thank you. So it is 50-50, but it's capped at the 2018 actual amounts. So back in 2018, what our actuals were, that's what they've capped, that 50-50 contribution from the province. But we're seeing increases in staffing costs and other administration that isn't being captured in that 50-50. So that's where we have to over-contribute.
So maybe I'm missing something. So the OW rates are 100% flowed through.
Mm-hmm.
Are they 2018 rates?
Mm-hmm.
Yes.
They're 2018.
Yeah.
And then the staffing rates, to be able to care for those files, our staffing costs have gone up because of the numbers that we have to serve.
Mm-hmm.
But the cap number was set at 2018?
The contribution amount from the province, yeah.
So if we stayed on that course, there's no possible way that we could assist the 9,000 Ontario Works clients. Interesting. I didn't know that. Thank you very much for that. Okay. So isn't this more of, is the associations that you belong to, are you having any conversation in regards to the OW rates, and that maybe this is not about a benefit aspect, but an income issue?
Through the chair, yes, we have these discussions regularly. I'm on the Ontario Municipal Social Services Association board. I sit on another provincial municipal board. It's ongoing, it's constant. We're asking them to look at sort of a basic income model. If they're not going to increase the rates, is there something else?
Yeah, okay. By the way, on page 54, 141, emergency social services in regards to, this is under drastic circumstances when a fire happens. Your team did a tremendous job, 18 different emergencies that you had to respond to. And that's quite complex, is it not, Commissioner?
Through the chair, yes, it is. We do have, it's through our Director Jonathan Dixon's area. We have just a small group of staff, but they work very closely with our DEM group and with Red Cross in order to address.
Are we able to, capture any of the funds that cost us to run that program? Is that supported through the provincial government?
I'm going to look at Jonathan. Jonathan, can you help me with that? Thank you.
Only if we're working.
The fire happened in 2000?
It's a regional, it'll be a regional.
Sorry.
Yeah, regional cost, unless we're partnering with like Ontario Works.
Okay.
Yeah.
Okay, all right, great. No, I appreciate that. That's an important part. Under G, it says 3,609 primary care outreach program interactions. Is that a number that's increased also in the last year?
Through the chair, yes. I'm looking at my colleagues, yes.
Okay, and that's again, that program costs money and it does tremendous work, so it's absolutely wonderful. I noticed that you've added 2 outreach workers in regards to Durham Regional Transit. Is this a cost sharing between DRT and social services to be able to provide this program?
Through the chair, DRTS is actually paying for the 2 outreach staff, yes.
Okay. I'm just asking you for food for thought. I was at an opiate summit yesterday, and a suggestion had come out in regards to the outreach workers that they had said that it would be advisable because of the large population of First Nation individuals, that as we expand the outreach program, maybe we could take into consideration Indigenous outreach workers that would be included in the next phase of expansion of the program. The point being is that peer-to-peer in that classification is really important, and that they're not being represented at this time. So I'm just asking if you wouldn't mind taking that under consideration. I thought it was a great catch. I had no idea in regards to that aspect. And I also noticed on 6.6 that there's a discussion in regards to Ontario Works. More and more of the cases are showing that they have mental health or addiction issues, and that brings into the complexity of them being able to seek new pathways. Is that correct?
Yes, that's correct. We're seeing that for sure at least a third are saying that they're struggling with mental health and addiction issues and can't find work.
And now, do we have the opportunity to advocate to be able to push them to ODSP then?
Yes, we're working through that as well. We have a couple of really good programs that are supporting those who have been on assistance for a long period of time or who have expressed their need for additional supports to try to get them on ODSP.
I know that both you, Dr. Kyle, and others have talked about the concerns about the provincial budget, and I'm presuming that that's what concerns you as we move forward.
Very much so.
Thank you. Thank you, Madam Chair.
Thank you, Mayor Carter. And Councillor Dyes.
Thank you, Madam Chair. Just curious about the numbers again on the by name list, on the dash list, and the refugees that need to be housed as well. Is there an ability there to work with other communities that may have spaces available? Is that something that we do on a regular basis to try and accommodate? I know everybody's pushed to the limit, but with the number of refugees coming in, sometimes they're able to relocate through CDCD.
So through the chair, certainly we know that the region of Peel is working on a reception center to accommodate the influx of the asylum seekers. Perhaps through that avenue, if it ever starts, or maybe when it starts, we might see an opportunity where we can work together and they can, temporarily stay somewhere and then move off to another location.
Does the new Immigrant Welcome Center work in that capacity as well here in Ajax?
I'm looking to my team to see CDCD. Yeah. So CDCD is our provider right now, settlement organization for the refugees. They do a lot of that work, and currently we are still supporting through Ontario Works and our housing workers as well.
Okay, thank you.
Any further speakers or questions from council? Not seeing any. I do have questions just with relation to within the pie chart, and well, it's actually also with the amount of money that's coming identified from the property tax, and some of the future pressures that has been identified is through Bill 23. Well, let's hope March 26 that might be, we don't know what's going to come out of it, but what are some of the major concerns about Bill 23 that impact for our housing and for our stock that we're trying to work with?
Well, definitely not having the funds to be able to build any of the housing, and I know you are all aware of the housing projects that are in the pipeline right now. It'll be a very expensive. These are going to be expensive projects for the region of Durham if something doesn't change.
Okay, I appreciate that, and thank you to all for Commissioner Taylor.
I was simply going to add, if you wanted some context of dollar values.
Yes, please.
So there are two impacts that are very clear for social services. You wouldn't think so because we don't have a development charge necessarily, but the first one is on the general tax side. Our current estimates are that we're about a $470 million impact shortfall over the 10 years. So this group knows that if we have a tax levy cap, which this entire council struggles with, and we have to fund $470 million, then that has a direct bearing on how much operating budget allocations remain. The second piece is when this Bill 23 eliminated housing as an eligible component of development charges. In our last bylaw, we were looking at 31 million as being collected over that time frame. So we're not able to charge at all to collect any of that. So it's foregone by that. So that's another 31 million that we don't have towards capital programs like the DLHC redevelopment initiatives.
Okay, appreciate that. I do have another question that has to do with our childcare and both the impact of the $10 a day, but the size of that budget. And I know we've had this conversation, but I don't think as a whole it's really understood the size of that budget. If we were to compare the childcare budget, what other budget, and I know the answer, what would be the other budget we would be comparing to within the organization?
Within the organization, I'm not sure if maybe Commissioner Taylor could help me with that one.
Can you rephrase that question for me?
So within our total budget, what other department has the same amount of money that's contributing? Like what's another budget? I know the answer is police.
Yes, as far as the magnitude of the component of the budget, social services certainly is a very, very significant one, and police would be on par. Perhaps works if you included all their capital, but from an operating perspective, social services would certainly be the
And for the interest of what's happening, especially with the changing of like the $10 a day and all that, we're going to see substantial changes within the daycare component of it, and I think that's an impact that we all really, really need to be aware of. While it's great for our young families, it's the overall impact that's going to have on the taxpayer.
I can add to that through the chair. We are waiting for a new funding formula for the Ministry of Education for this program, and that will determine exactly how we're going to manage it moving forward.
Yeah, well, I appreciate it for my grandchildren and for my son and that. I know the struggles that it's going to end up creating. But I do want to thank all for the work from Dr. Kyle's team and to your team as well. I know that working through this budget has been a difficult one, and to get to be able to provide the services as best as we can with what we have, you have done a phenomenal job. I think the context of hearing back from the feds, especially around our 2023 contributions, that should be coming back to us. And it's very clear from how we take a look at all of the funding formulas that are, whether it's health or social services and housing, it needs to be brought up to the current date. It needs to be up to the cost of what today is. And I think that needs to be a big focus of this whole budget as to what we should be receiving as a regional municipality. Chair Henry, did you want to close?
Thank you again for the opportunity, but just to the comment on funding that comes to us. This funding, Commissioner, don't leave, because I'm going to do it in the form of a question. So when we do receive the funding that we've put applications in for, it simply goes back to the funding source it came from.
Sorry.
So, for example, the money that we're spending on asylum seekers.
Yes.
We're drawing from other parts of this budget.
Correct.
So when we get money, it's not a windfall.
Mm-hmm.
It just pays the bill that we currently have. And that's the sad part, because we've spent the money. Now we're hoping to get the money related to the challenges. It doesn't, you can pick any one of a number of ones we're having, but it simply is just a recovery. And with no additional funds to manage this yet, the challenges of every regional department continue to grow. So it's not just health and social services, but it's police, it's works, it's planning and economic development. Every part of the organization is struggling. And Mayor Carter, I just read your letter that you had sent to me. You know, I would hate to think that distribution of funds is in this country is done by the color of your representative, whether you're a liberal or a conservative in whatever riding, and then using that to fund things when funding should be on an application basis and treated equally across this country to make it fair and equitable for everyone that pays into the system. You know, Madam Chair, I am challenged as the father of and a grandfather trying to figure out where my grandkids will be 20 years from today and the challenges that come back to each and every one of us. But the answer is not fixing our problems on a property tax. When the government takes between 30 and 50% of every dollar that most people make, and then 13% of everything we buy, everything else is paid for with what's left, and then we charge a tax on what's left in the form of property taxes. It is the worst sustainable model of business ever. And yet every year, communities across this country have to deal with the challenges that our residents ask for. Support for policing, support for healthcare, support for paramedics, support for daycare. And we can only do it when the 4 levels of government work together as a united team to make the lives of our residents what this great story about this country is. You know, we're the lighthouse of the world. And yet people here are struggling. People are sleeping on the streets. People are going hungry. And we're one of the richest countries in the world. I know we're not going to fix it as a municipal government, but you should not be punished as a member of a council anywhere for standing up and saying, this is wrong. And Mayor Carter, I have been told that I have been heard in Ottawa and they're not happy with me. I can't imagine why. I think I'm polite. I know I'm well-spoken. But when this is a challenge, and they should hear us on these issues. We deliver these frontline services. The work that our team here at the region and the municipalities do is unprecedented. No other levels of government deal with that. They don't see it. They don't hear it. In fact, they'll tell you that, you know, I know that I have been told, and our CAO has been told, that we know nothing about homelessness. Nothing. Shocking. And yet when you invite members of other levels of government to tour communities where there is homelessness issues, they don't accept. You know, I think prior to the next federal election, which will be the first of 2, that every candidate and every party should tour the downtowns of the communities they're canvassing in and actually see what's going on, so that when they sit down and make decisions, they can help us as a partner fix the problems. And members of council, I'll apologize to you. If my actions on behalf of council has led to the lack of funding, and I'm sure it has, I'm only delivering that message from from council that we need the help, the guidance, and the support from the other levels of government to do the right thing. And I will be continuing to act on behalf of council to deliver those messages. But I have no party affiliation. I'm an independent. So I'm happy to compliment the levels of government when they bring funds into our community and stand beside them and thank them. Like we had a great week this week in Whitby. But that should happen in all 8 municipalities in Durham Region, not just in Whitby. So thank you.
And from all levels of government. Just saying. I agree. Like it shouldn't have to, because you're advocating for your community, you shouldn't be penalized at all. You shouldn't, but we do get penalized, and you know, it is what it is, and it's the right thing to do, and I was brought up that way. If it's the right thing to do, then you do it, and we shouldn't be told not to say it. We should be loud and clear, and as you know, many right now that I'm in the midst of this right now for an 8-week campaign, but it's show me the money. And on that, all in favor? Thank you. We have no further reports and no further business. Our next meeting is April 4th at 9:30, and motion to adjourn. Chair Henry, seconded. Councillor Brenner. All in favor? Thank you.